What is epilepsy? The World Health Organization says that epilepsy is a chronic, non-contagious disease that affects the brain and affects about 50 million people around the world. It is characterized by recurrent seizures, which are brief bouts of involuntary movements that may involve part of the body partial or the entire the body general, and are accompanied by sometimes lost consciousness and control of bowel or bladder functions. What are the causes of epilepsy? WebTip website says the presence of electrical charge in the body leading to seizures resulting from one of the following causes. First, brain damage. This damage may occur to the child while he is in the stage of formation mother's womb as a result of lack of oxygen or exposure to the mother trauma. Second, inheritance. In some cases, epilepsy is a hereditary disease that is transmitted between some members of the same family, and this is the result of an imbalance in a specific gene. Third causes, brain infection. A person may become infected with electrical charge at any age as a result of exposure to the infection that affected brain cells, such as meningitis, and other reasons include drug abuse, brain tumor, and severe head injury. What are the symptoms of epilepsy? Uncontrollable jerking and shaking, losing consciousness, and staring into space body stiffness. Second, strange sensations, such as feeling bloated in the stomach, flatulence, unusual smells or tastes, a tingling feeling in the arms or legs. Third, temporary loss of consciousness. Fourth, muscle twitching. Fifth, temporary confusion. Sixth, slow thinking. Seventh, problems with speech and understanding. Eighth, psychological symptoms including fear or dread or anxiety. Ninth, accelerated heartbeat or breathing rate. What is the current treatment for epilepsy? WebTip website says there are 3 ways to treatment the electrical charge. First, treatment with medications. There is a group of medications that helps treat electrical charge and prevent the body from being exposed to seizures if taken daily. The most prominent types of these medications are the following: sodium valproate, carbamazepine, lamotrigine, topiramate, levetiracetam. Second, surgical treatment. Surgical treatment is considered in the event that drug treatment is ineffective. This treatment aims to remove the area in the brain causing the seizures. This surgery is considered dangerous and may result in very serious effects, most notably the loss of skill, such as speech. Third, treatment by placing a device on the body. The principle of this treatment is based on placing a device under the skin of the chest area and connecting the wires of this device to the vagus nerve in the neck. This device, which contains a battery, delivers energy specific to the brain to prevent seizures. This treatment reduces the rate of seizures by only 20% to 40%, followed by continuing to take anti-epileptic medications. All this is to stop epileptic spasms only, not to treat electrical charge. Is epilepsy curable? There is no cure for epilepsy according to the Cleveland Clinic magazine, but there are many options for treating it. About 70% of people become seizures free within appropriate treatment within a few years. As for 30% of patients, they are considered to have drug-resistant epilepsy. These people should go to a center that specializes in treating epilepsy to determine if they are candidates for epilepsy surgery. How many years do epilepsy patients live? According to a study published in journal Brain, epilepsy carries a risk of early death. What is the new treatment? In traditional Yemeni medicine, we drawing charge from the brain through the navel to the body of the patient. I know, someone will say these are myths. This is a lie. I will prove that to you scientifically. Let us first begin with anatomy of nervous system. Epilepsy is found in the nervous system. The central of nervous system consists of brain and spinal cord. The rest of the nerves in the body or in the peripheral nervous system are connected to the spinal cord. This is the spine that contains the spinal cord. Notice this area below the spine, behind the navel. It is communication center, most nervous. Let us move on to the anatomy of the navel. An article published by WebTip entitled "What are the benefits of the navel?" It wrote in the article, the navel includes the thinnest layer of the muscle between the vagus nerve and the skin. Massaging this area helps revitalize and stimulate the vagus nerve, thus affecting the brain positively. The navel contains approximately 72,000 nerves, which makes it a focal point in the body, and taking care of it helps stimulate all these nerves. The navel is an anatomical landmark of locating the body's organs. Different types of traditional medicine. Approximately 2,368 different species of the germs live in the navel. Germs are unique to the world, its type, which play an important role in the health of the body. The location of the navel is connected to the optic nerves, intestines, and organ system, central nervous system, and this indicates its physical importance. It is the origin of many ducts and pathways that feed the stomach and the intestines. Focus with me on the most important points mentioned in the article. The navel includes the thinnest layer of the muscle between the vagus nerve and the skin. Focus with me on the vagus nerve, this area. One of the effective methods of treating epilepsy is the vagus nerve stimulator. Third, anatomy the cloaca of male pigeon. Cloaca is the last anatomical section of the digestive system for birds and reptiles. It consists of 3 sections. The first is corpodium. It connects of the rectum. The second is the podium. It connects to the opening of ureter and reproductive system. The third is aplangium. It connects to the outside through the vented lips. Treatment method. 3 cases of shipments were handled. Treatment method. We begin first with blocking the private parts of cloaca of the male pigeon's feathers. Then, we placing it on the patient's navel. It is not necessary for private parts of P inside the navel. We are satisfied with just touching them. The patient is in a reclining or semi-reclining position. The first pigeon remains for half an hour without moving or being affected. Then, after half an hour, the pigeon begins in pain and screaming. Because the charges have reached its body, the pigeon will continue to scream until it dies. Bring another pigeon and repeat the same steps and continue doing so until all the charges are removed from the body. When it reaches the pigeon that remains alive for more than half an hour without to scream or die, this meant that the charges have left the body. Important note: during treatment, the temperature of the patient's navel will be high, and if the injured person is a child, he will cry a lot. If you want to make sure that this is not hoax, try it on a person who isn't not infected with epilepsy, and you will see that the patient doesn't die. In traditional Yemeni medicine, the method is used to treat many other diseases, such as yak of the liver. But I only talked about electrical charge or epilepsy because I tried this method myself and it worked. Witness to the sincerity of the treatment. This is Sheikh, who says that his method is false and that the patient suffers, and this is the reason for its death, and that this is marketing method for selling patient.
يشفى المريض، تسحب الطاقة السلبية أو تسحب المرض أو الفيروسات وتموت الحمام، وهذا كذب وفيه خدعة، وهذه بداياتها كانت فيه خدعة كما ذكر كثير ممن تتبع هذا الأمر، وجدهم يخنقون هذه الحمامة بهذه الطريقة ليلبسوا على الناس ويجعلوا الناس يشترون الحمام أو يعتقدون اعتقادات فاسدة. فاتركي هذه يا أخت الفاضلة.
If you look at the comments and their translation, you will read the opposite. In the last comments, you will notice that the user said use bathroom. He meant the pigeon, but in Arabic language, bathroom and pigeon write in the same way. For the people who will demand the rights of the pigeon in life, I will say to them, a pigeon that saves a child's life from pain is the same pigeon that a person will eat it for lunch.